How would you characterize the difference between research that takes place in the military compared to research that takes place in the rest of the world?
Well, I think they are far more alike than dissimilar, but there's a lot of misconceptions. So, and if you're thinking research with the military, like research with the military population, a lot of people think, I'd really like to do research with the military population. They do what they're told. They're very orderly. It's gonna, everything will just go like clockwork. And in the DoD, we're very, very sensitive to the hierarchical issues that are in our system, and that a basic trainee or a private, they're pretty powerless. And but I always make the case that we don't hire people, or we don't allow people to join the military to make them powerless. We need them to be autonomous thinkers. We need them to be problem solvers. So there's a tension. You've got this rank structure, and then you have, and people who are doing research, if they're active duty, tend to be higher rank. But we take great pains to ensure that the voluntariness of this. So, like, if let's say, for example, you're gonna talk to a group of soldiers, and you want to recruit them into a vaccine clinical trial, because, and this was a real case, we have a type of pneumonia that is occupational hazard in basic training. And we used to have a vaccine for it, and it went out of manufacturing, and we had to bring it back. So we had to do a clinical trial with basic trainees, to me the most vulnerable, because they're scared. And we have ombudsmen there. We take great pains to ensure that they each have an individual consenting experience and are able to ask questions, change their mind. They don't feel that this is part of joining the Army. You have to roll up your sleeve and be in research, So, I use every opportunity I can to dispel those myths of involuntariness in research. So, I think we are a great population, because if you're studying, let's say, something like, any disease that has a confounding factor of socioeconomic status or access to health care, and then you study that disease or condition in the military, you know that they all have access to health care, and and although at lower ranks that they're not, very well off, hopefully nobody's on, so socioeconomically deprived that that's a risk factor, although it's possible. So, it does have, it's a heavily male population, and but yeah, people love to do research with the military.